Swayam Prabha. Digital India. Educated India.
Good morning, everybody. I am Dr. Vikas Mehdi. I am professor in PGI Chandigarh. Today, we are going to discuss a very important topic called contraception or contraceptive agent. Now, this topic is important to India because, as you can see, that the population is going on increasing, and people say you might cross the Chinese population. Growth rate is very, very high. Now, what you have, like when you talk about fertility, it is natural ability to reproduce. So, when you look at the scientifically fertility and age, in case of a female, it is 30 to 35 years. That means it is from puberty to menopause, or in case of a male, 40 to 50 years, puberty onwards. Earlier, we used to have a lot of discussion on family planning. So, basic purpose is family planning is it's a limitation or spacing of the birth in the best interest of the mothers, or to have a healthy child and the rest of the family. Now, contraception, when you talk about contraception, it's nothing but a birth control. That means you in order to prevent pregnancy by interfering with normal process of ovulation, fertilization and implantation. Now, this system is allowed to choose whether and when to have a child. You can have a family planning, and some of this method of contraception, it also prevent sexually transmitted disease, like we have a barrier method. Now, these are the measures are temporary, or there are some measures a permanent. I will be talking about contraception in case of a female, or contraception in later part in case of a male. Now, this is to design how to prevent the pregnancy due to coital act. Now, as you know that there is a need for family planning, because in order to bring down the population growth, at the same time you have to also think that maternal mortality and infant mortality is very, very high. So, in order to prevent pregnancy that are too early or too frequent or too many, so this is going to reduce the maternal mortality and infant mortality. Now, contraception is much more effective if both partners are participating. So, there are a lot of motivation is also required. Now, contraceptive have contributed to women financial stability, health, career advantage. There are so many other factors is also involved. Now, as you know that fertility can be controlled by drugs, and which mainly if you look at the mechanism, that when you give the drug, it acts as a contraception or prevent pregnancy by inhibiting the ovulation or modifying the cervical mucus, or many of the drugs that interfere with implantation, or some of the drug it slow down the egg transport, or it can prevent the ovum maturation and sperm capacitation, or there are so many immunological methods is also there. Now, we have an example of vaccine and also drug that inhibit the spermatogenesis in males. So, there are so many mechanisms. One is by inhibiting the ovulation, or you can alter the mucus of this cervical area where the sperm cannot penetrate, or it also have that there will be no implantation, or it can slow down the egg transport. So, there are so many mechanisms that it can cause that you can use as a contraception. Now, when you talk about ideal contraceptive, because there are so many methods available, and every method we describe that what are the advantages, and we look at the failure rate, how much is the failure rate. So, in order to talk about ideal contraceptive is should be highly effective. Of course, there should not be any side effect, or maybe there is a tolerable side effect, or it should be independent to sexual intercourse, or it should be rapidly reversible. It is affordable also. People should able to buy it, and there should be widespread availability, and it should be easily distributed across the area, and acceptability is very, very important. Now, in case of administration and healthcare person is not required, because if it is affordable, acceptable, or there is no assistance is required, and at the same time you require a minimum motivation and maintenance and supervision. So, ideal contraceptive is you look for a high efficacy, less failure rate, and there is no side effect or less maybe tolerable side effect, and it is rapidly reversible and affordable. Now, when you look female contraception, you can divide there are surgical method, there are non-surgical and surgical method. Of course, all these methods are you can take about non-pharmacological or pharmacological, and when you talk about pharmacological, there is a hormonal approach. By giving the hormones, it acts as a contraception, and there are some preparation which is non-hormonal. Out of the hormonal preparation, we have so many options like combined pill, only progesterone pill, implant. Similarly, for non-hormonal also we have intrauterine device or spermicide. So, there are surgical option and non-surgical option, and out of these non-surgical option you can also make it available as pharmacological action option or non-pharmacological option. When you talk about pharmacological, the hormonal preparation are there. You can take an example of combined pill, I will be talking in detail, and non-hormonal are I use intrauterine device or spermicide. Now, how to choose a method? As I said that when you select a method, it depends on what are the advantages or acceptability, because there are many forms are available, but none of them are perfect. Some are at some advantage, some are has some limitation are there. So, it has advantage and disadvantage, or it also varies in terms of price, in terms of effectiveness, or in terms of convenience, or in terms of safety. So, choosing a method is important to look at all the factors, and looking at that you choose the method. Now, when you talk about non-pharmacological option, basically these are applied in order to protect pregnancy without influencing the natural hormones of the woman. So, when you consider non-hormonal method for birth control, like for example, backing up a hormonal method like use of barrier method like condom to further protect against pregnancy, and at the same time it reduce the risk of exposure like STD, sexually transmitted infection, or experiencing undesired side effect, having a contraindication to hormones. Many situations you cannot use hormone, there is a contraindication. So, there barrier method can be applied, for example, a condom, or you can have an alternative that do not want to alter body natural rhythm or infrequent sexual exposure. Now, when you talk about rhythm method, it is basically a calendar method, or it is a safe method or natural method. So, when it is applied, it is a voluntary avoidance of intercourse by a couple during the fertile phase of menstrual cycle to avoid the pregnancy. But it is always depend on a time of ovulation. For example, you can call it the risks of the ovulation. Suppose ovulation occurs on 14th day. So, ovum is viable from 14 days almost 48 hours to 72 hours. So, during the time if there is a exposure risk occurs, so the risk is there within 24 hours to 48 hours. So, pregnancy can occur if there is a sexual exposure during this period. So, by calculating that calendar method, one has to be sure that what is the ovulation period, and from the ovulation period within 72 hours it should be avoided. So, safe period may be you can practice is 5 to 6 days after the menstruation or 5 to 6 days before the next cycle is started. Next is barrier method. Barrier method is worked by preventing the passage of sperm into the female genital tract. So, both the barrier methods are available for male as well as female, like you can take an example of condom, diaphragm or availability of cervical cap. Now, in case of a male condom, when you look at the preparation of male condom, it is mostly prepared by latex condom because it is cheap and it is widely available over the counters. But some people also develop allergy to latex condom. So, they can have a polyurethane alternative to people who have a latex sensitivity. Now, in case of a female, the condom available has a closed end and open end, and basic purpose is to prevent the sperm from entering into the cervix. Now, both this barrier method, it very much helpful in order to prevent sexually transmitted disease. So, this has an advantage along with prevention of pregnancy. Look at the other method, like we have a diaphragm. If you can see this diagram, this is a shallow dam-shaped flexible rim. It is inserted into female genital tract over the period of cervix. And another example is cervical cap. It is nothing but a smaller than diaphragm. It is also applied into the cervix. So, in female that we have a diaphragm and cervical cap. Now, when you look at advantage of this barrier method or diaphragm or cervical cap, it is inexpensive. You do not require a medical consultation. But at the same time, you have to also look at the disadvantage is that it should be initially trained by a skilled person for proper use, because many times because of improper use there is a failure, and failure is because there is a due displacement of the devices. So, it might also lead to cervicitis or local irritation, because these are the foreign bodies. So, one has to be careful that properly should be used in order to avoid the failure, and at the same time one has to be look for is there any incidence of cervicitis and local irritation to the tissue. Now, coming back to pharmacological method. Now, when you talk about pharmacological method, we said hormonal preparation. Hormonal preparation, like we have a estrogen and progesterone in varying concentration. Like we have a preparation oral contraceptive pill, you popularly call it OCP. We also have injectable one, we have also implant. Now, these are safe and effective, means efficacy you can say 99.9% when it is taking in a proper method. But at the same time, this hormonal preparation like other method it prevent STD, it do not prevent STD. But it is very convenient, it is cheaper, it is easy or simple to use, it is very much commonly used, and it is readily available, and it can be administered by any non-healthcare personnel. Basically, it is a reversible. That is why it is more popular. So, when you talk about OCP, oral contraceptive pill, it is recommended that women with younger group, particularly less than 35 years, it is recommended. So, basically these are synthetic preparation of estrogen and progesterone. When you talk, it is given orally. So, what happened? We have release of estrogen and progesterone. So, when you give orally, there is a negative feedback effect occur from the anterior pituitary, and that inhibit the release of gonadotropin, FSH and LH, and that is how it inhibit ovulation. So, giving orally, it inhibit the gonadotropin from anterior pituitary, FSH and LH, and ultimately it lead to inhibition of ovulation. Now, what are the different form of OCPs we have? Oral contraceptive pill. One is, you can remember as combined pill. Second thing is phase regimes, and we have mini pills, and in case of an emergency, postcoital emergency contraception available. Now, let us discuss about advantage of all this preparation. Is basically it is used for prevention of pregnancy. At the same time, when it is used regularly, it also avoid cramping pain of during the menstruation, or it also shorten the regulates the period, it decrease incidence of ovarian cyst, and it has been reported that it prevent ovarian and uterine cancer, and number of incidence of acne has also been decreased with use of OCP. But at the same time, it has a disadvantage that may cause whatever we have commonly reported with hormonal adverse effect. Now, any product containing estrogen, it may be associated rare, but there could be serious health risks also. As I already said that by using hormonal preparation, it does not give any benefit in order to avoid or against STD, sexually transmitted disease. And compliance is very much required, that patient need to require the adherence to the treatment for successful benefit. Some of the commonly adverse effect it is reported is breast tenderness, nausea, some people complain of headache, or change of mood is also there, and there is also incidence of weight gain, or people reported with spotting and breakthrough bleeding. Now, in case of a non-contraceptive benefit of OCP, there is a huge number of lists that it give benefit, like reduction of endometrial cancer, reduction of ovarian cancers, notably after 3 years of treatment, reduction of benign breast disease, or incidence if you see that anemia, it has been decreased, or incidence of dysmenorrhea, or incidence of pelvic inflammatory disease, or ectopic pregnancy, colon cancers, or incidence of acne, or you can say that female prone to have osteoporosis, the incidence is decreased over a period of non-contraceptive benefit, you can say by using OCP. So, there is a huge number of lists that number of disease has been reduced, including ovarian cancer, endometrial cancer, dysmenorrhea, incidence of anemia, osteoporosis. So, there is marginally that benefit is along with use of OCP, is there. Now, as I said that OCP, we use combined pill. Combined pill means it contains both estrogen and progesterone. Now, most of the commonly used estrogen in combined pill, you can see that it contains ethylene estradiol, and most commonly used progesterone OCP is levonorgestrel. Levonorgestrel. Now, what is the mechanism of action? Basically, it prevents ovulation and implantation. Now, how it prevents ovulation and implantation? Because by giving combined pill, it helps to thickening of the cervical mucus, so that the sperm cannot penetrate through cervix. So, usually the dose is given, ethinyl sterol is 30 microgram per daily, and it is considered a threshold, but it can be reduced to 20 microgram per day, and if the progesterone, it is a potent anti-ovulatory, is included. So, combined pill it is given because it prevents pregnancy, ovulation and implantation through thickening of the mucus, and that is why it has been given. Now, this combined pill can be also given monophasic. That means, estrogen and progesterone, it is remain, the strength is remain same in the pills, or you can plan as a biphasic. That means, content of progesterone in different pill after 10 days, then 11 to 21 days, it is different. Or you can have a triphasic. One is monophasic, content is similar, estrogen and progesterone. Biphasic, content of progesterone in different pills, like in a first 10 days, then rest 11 to 21 days is different. Triphasic, content of progesterone is gradually increased. Like you can say example, lowest during the first week 1 to 6 days, then moderately increase 7 to 11 days, then it is increased in third phase 12 to 21 days. So, monophasic, biphasic, triphasic. Now, in case of a biphasic and triphasic pill, progesterone reduced without compromising its efficacy. That means, it decreases the risk of breakthrough bleeding. It is given every day for 21 days, then followed by pill-free period, and that is why different regimes are practiced. Now, there are situations where compliance is very important, but if some women it miss one tablet, what do you advise? You advise that next time she should take 2 tablets in the next day and continue as usual. But in case of more than 2 tablets is missed, so what you do in that course? Should you interrupt that course? That means, we have an alternative method should be applied, and next course should be started 5th day of the bleeding. So, in case of compliance is not maintained, miss one tablet, add another tablet in the next day, but if it is more than that, then definitely you have to practice that alternative method and continue the course after 5th day of the bleeding. Now, in case of a mini pill means progesterone only pills. It is preferred in women where you cannot give estrogen. That means, estrogen is contraindicated. So, you prefer the mini pills. Now, when you select the dose, the daily through whole menstrual cycle and action, because progesterone it is inhibit the ovulation, and that is how it prevents fertility. The mechanism is that by giving progesterone, there is a thickening of mucus, and because of thickening of mucus in the cervix, the sperm cannot penetrate, or it also inhibit the motility of fallopian tube, and that is how it inhibit the fertility. It has lot of advantage. Usually women as already mentioned, in case of contraindicated to estrogen, or it is used in postpartum women who are breastfeeding, or it does not require any vaginal insertion. But it has a disadvantage, like in case of a higher pregnancy rate, combined OCP less effective than combined OCP, and it is also associated with abnormal bleeding and side effect. So, it has advantage and it has limitation also. Now, let us talk about postcoital pill. That means, in case of an emergency, we call it emergency contraception, and that is been advised within 72 hours of unprotected sexual exposure. Now, if it is effective till 122 hours following unprotected sexual exposure. However, it is not indicated for a regular method or contraception because it is less effective. Now, looking at the mechanism, basically postcoital pill, it prevents fertilization, it prevents implantation. How it prevents fertilization and implantation? Because hypermotility of fallopian tube, it inhibits in fallopian tube and uterus. So, if ovulation and fertilization occurs, then it prevents implantation of blastocyte. And option we have, we can also put copper IUD, intrauterine device. It is more effective than the oral emergency contraceptive agent. And this copper IUD, it can be put within 5 to 7 days after unprotected intercourse. Then another option we have is Lipstrel selective progesterone receptor modulator, and this is also effective up to 122 hours following unprotected sexual intercourse. Basically, this drug, it inhibits the LH, luteinizing hormone release through hypothalamus and pituitary, and it inhibits LH induced follicular rupture in the ovary. So, it may block endometrial implantation in case of fertilized egg also. So, it is effective till 120 hours. Now, most commonly used postcoital pregnancy is mifepristone. If you see mifepristone, it is mainly, it has an antagonistic activity because of some agonistic activity on progesterone receptor. So, what happened after giving mifepristone, it causes detachment of the blastocyte. At the same time, it also caused delay and prevent the ovulation. So, dose is usually selected is 600 milligram dose in a effective pregnancy contraception, and in case of a larger dose, it block the proliferative action of estradiol on the endometrium and causes endometrial atrophy. So, this is one of the drugs is most commonly used, mifepristone, and along with other drug we mentioned. When it is administered in women in early late luteal phases of menstrual cycle, basically you can say that it has a lytic properties because it inhibits the uterine granular secretory activity. It accelerates degenerative vascular changes. It is leading to menstrual bleeding within 72 hours. Now, in case of a plan B, where it contains 2 tablets of levonorgestrel, 75.75 milligram each, and it is more effective if it is first dose is taken within 72 hours following a sexual intercourse. Now, coming to disadvantage of OCP. Though there are a lot of advantages, OCP also result, it can cause hypertension. There is a risk of thromboembolism. There is also altered metabolic effect. Some people they develop diabetes and obesity, because we have seen that one of the side effect is increase of body weight. Though there are so many disease reduced like ovarian cancer, endometrial cancer, but there is chances of carcinogenic effect in case of breast or in case of cervix. There is also reported a breakthrough bleeding, and this is the most commonest problem for use of progesterone non-deeply. Some people develop cholestatic jaundice, gallbladder disease is increases, and those who suffer from migraine, it has been seen that it accelerates the condition of migraine. So, the disadvantage is also huge with hypertension, thromboembolism, chances of cancer of breast and cervix. So, these are some disadvantages there. But one has to be careful that you should not use OCP if it is contraindicated. Now, what are the conditions it is contraindicated? Like in case of coronary artery disease, in case of cerebrovascular disease, in case of deep vein thrombosis, those who are suffering from CA breast, diabetes, hepatic adenoma or carcinoma, in case of pregnancy, in case of uncontrolled hypertension, migraine, or women more than 35 years. Women more than 35 years which should not be preferred. Now, we have lot of depot preparation are available. Depot preparation are oily solution given intramuscularly. That means, you can see depot preparation, it has progesterone, and one of the progesterone is medroxyprogesterone acetate. You call it DMPA, and it is given intramuscularly every 3 to 6 months, 150 to 400 milligram. Another preparation is norethindrone. It is also given intramuscularly every 3 months with 200 milligram it contains. Second is also we have a preparation of combine both estrogen and progesterone. It is given intramuscularly monthly basis. So, mechanism if you see that it prevent ovulation. How it prevent ovulation is by altering the cervical mucus secretion. The mucus become thick, so that is how it prevent ovulation. Now, there is some example of markedly available depot contraceptive injection 150 milligram per ml, and this is also depot preparation which is available in the market given intramuscularly. Now, this preparation has advantage. It is highly effective. I can see that if it is given once in a month, maybe compliance is good. It is conveniently 3-month administration schedule. So, there is an encouragement of adherence, and it is useful when, because it can be also avoid estrogen, and it has been also reported that it decrease endometrial cancer. But it is also reported that disadvantages are there is a report of irregular bleeding or amenorrhea which is very frequently occur compared to any other method. But at the same time, people reported weight gain, abdominal pain or depression are common side effects. So, prolonged use may decrease, like it affect the bone mass. So, one has to be careful about that. Now, another most convenient use of route of administration is transdermal patch. It is alternative to OCP. This transdermal patch, it contain ethylene estrogel and noryl gastroamine. So, this is one of the contraceptive patch apply. It is given each week for 3 weeks to abdomen. It can be applied in abdomen or upper torso or buttock. So, no patch during 4th week of withdrawal of the bleeding occurs. It has been reported that it is less effective in women, those who have higher body weight, more than 90 kg. It should not be recommended. So, total number that requirement of estrogen exposure may be greater compared to OCP. So, transdermal patch is very, very convenient. However, those who have more than 90 kg of body weight should not be preferred use transdermal patch. Now, other than transdermal patch, we have lot of implants. For example, we have a NOR implant, which comes 6 flexible elastic tube of 35 milligram of progesterone. Then we have NOR implant 2. It has 2 rod of levonorgestrel. It is given, put it beneath the skin, either in the arm and forearm. So, the duration of action of this contraception lasts for almost 6 years, 5 to 6 years. So, these are some examples that how you put it, these implants. So, these are some example putting it underneath. You can take this example how in the forearm it has been put. Implantation 1 rod 68 milligram etonosterol and which is last for almost 3 years. Now, though advantage is duration of action, it is among the most effective method like intrauterine device or you can say vasectomy, and it has failure rate is less than 1%. Now, this method does not require frequent follow up. This is one more advantage that frequent follow up is not required and patient or person can immediately return to fertility once it is taken up. But at the same time you have to also think of side effect is the female complaint of irregular menstrual bleeding. There is a frequent incidence of headache or result of infection at insertion site and it is very difficult to remove also. So, these are some disadvantages or side effect with implant is there. Now, another commonly used is vaginal ring, and this vaginal ring it has ethylene estradiol and etonogestrel, and this ring has inserted into the vagina and it is left for almost 3 weeks and then it is removed. On the 4th week, no ring is used and withdrawal bleeding is occurs. So, it is given for 3 weeks 21 days, then it is removed. So, natural the bleeding is occurred. So, adverse effect if you see that though it is alternation to menstrual bleeding pattern, but there is an incidence of report of leukorrhea, incidence of vaginitis or the discomfort, or there is always a sensation foreign body sensation and also patient is not comfortable during the coitus. Now, let us talk about intrauterine contraceptive devices IUCD. Though it is an ideal candidate, in case of when you consider it ideal, those who has born one child with a normal menstrual cycle, there is no incidence of any pelvic inflammatory disease and they are ready to check for the devices. So, basically it is not a abortifacient, it is basically it is a reversible procedure IUD, and of course, you need to understand that it is not going to prevent any STD. So, first generation of IUD, it has been prepared with no medication. Like for example, we have first generation is lips loop. Then we have second generation of IUD which is medicated IUD, and example is Copati. Then we have another third generation IUD, it is hormone is added to IUD. It is name is Progestostat. Now, how it act? Mechanism of action. Basically, you are inserting a foreign body. So, there is a foreign body reaction and example with copper T, the copper affect the enzyme and motility. So, it also affect the viscosity of cervical mucus. So, when it is affecting the viscosity, the sperm cannot enter into the cervix and it is prevented, and also at the same time endometrium is unfavorable for implantation. So, one is it prevent the entry of the sperm, and endometrium is not favorable for any implantation by using intrauterine device. There are number of adverse effects, start from vaginal bleeding, people complain of pain, there is incidence of pelvic inflammatory disease, there is also rare incidence of uterine perforation and incidence of ectopic pregnancy, spontaneous expulsion, then mortality associated with IUD approximately 1 death per lakhs of population. So, there are rare chances of death is also reported with IUD, and that is how there are absolute contraindication of IUD. Absolute contraindication in case of suspected pregnancy, absolute contraindication in case of pelvic inflammatory disease, vaginal bleeding, in case of carcinoma of cervix or uterus or any pelvic tumors or previously ectopic pregnancy is reported. There is also relative contraindication in case of an anemic patient, monorrhagia, or there is incidence of cervical discharge or history of pelvic inflammatory disease and fibroid. So, one has to be carefully evaluated before decide for intrauterine device, that is there any absolute contraindication or relative contraindication, and it should be avoided. Now, the indication for IUD removal is if there is period is missed, there is a continuous abdominal pain, or there is a infection is suspected, or patient complain that it is not feeling well, or there is a thread is missing, then it is think of that you should remove the IUD. So, the best time for insertion during the menstruation or within 10 days beginning of menstrual period. So, immediate postpartum insertion has high chances of perforation and expulsion. So, one of these complaint, one of these incidents that it can perforate, one has to be careful and it should be removed. This is an example of copper T, where it is basically a T shape, and this is advantage is it is effective till 10 years. Like you can take an example of copper T7, copper T200, copper T300A. So, there are so many examples. These are medicated intrauterine device, like we have first generation, this is second generation, and this has been shown that 99% it is effective, and it is also used, as we discussed earlier, that it is used as emergency contraceptive. Now, the third generation intrauterine contraceptive device is Progest Start. This is the first hormonal uterine device developed during 1976. This is also T shape. This device is filled with 38 milligram of progesterone, and this from this device the release of 65 microgram per day it is released from the device. So, when you talk about shelf life, it is like earlier copper T, it is almost 10 years. Now, this is up to almost 1.5 years. But it has an advantage that it has low compulsion rate, though it is expensive, and it is also reported that there is a higher rate of ectopic pregnancy. So, it is a medicated one, hormonal preparation are incorporated into this third generation IUD. Now, another is levonorgestrel intrauterine system. It releases levonorgestrel 20 microgram per day. It has advantage that it is highly effective. It stay in a place for 5 years, limiting adherence concern. So, it is given once, stay for 5 years, and it is decreased menstrual blood loss. But only thing is disadvantage, it required a skilled person, professional person for insertion as well as removal. There is an incidence of abnormal bleeding and dysmenorrhea of the pelvis, abdominal, and people also complain of back pain, or it may be appropriate for women with STDs. So, it may not be appropriate. So, this is one of the preparation. Now, in case of a terminal method, like we call it permanent method. Permanent method means you take out the uterus, hysterectomy, and indication for hysterectomy when family is complete, or there could be so many medical ground that you need to remove the uterus. Now, in case of a female fertilization that no past history of sterilization, age 20 to 49 years of age, at least one child with 1 year, method like we go for a tubal ligation. So, in this tubal ligation, the fallopian tube is identified, cut and ligated and buried. So, nowadays it has been done by laparoscopic occlusion, where tube is identified with silicone rubber and band, ring or clip, and method is quicker, very simple, no hospitalization is required. But one has to be ensured that permanent sterilization procedure for women, micro insert are placed into the fallopian tube, it causes scarring, and around the micro insert causes blockage. So, basically it prevents the sperm to reach to the egg, and occlusion is confirmed, you can do the histogram. So, you put a dye into the uterus and fallopian tube, you can see that whether blockage has been done or not. This does not prevent any sexually transmitted disease, but there is a chances that it can cause perforation and ectopic pregnancy. Now, another term is used is medical termination of pregnancy, and you can see that what are the indication for medical termination of pregnancy is, one is humanitarian ground, that means if pregnancy result of any unnatural act like rape or sexual assault, or it is eugenic, there is a genetic chromosomal abnormality detected in the fetus, or this could be therapeutic if carrying a full term pregnancy is posed to risk to the mothers, or there could be social if pregnancy result of contraceptive failure. So, period of gestation, usually medical termination of pregnancy preferred is less than 20 years, less than 20 weeks. Otherwise, there is a risk to the mother. So, method is adopted is dilatation and curettage, where cervix is dilated or implanted ova is removed by curettage of endometrium, or there is a method for vacuum aspiration also, 20 weeks, cervix is dilated or content are aspirated through vacuum and suction, or there could be administration of prostaglandin also. The role of prostaglandin, that these are administered intravaginally and it causes uterine contraction because of it is a potent uterine contractor, and ultimately it causes expulsion of the product following the contraction. So, prostaglandin are given along because in order to terminate pregnancy, and this method has been considered is 90% is successful. However, high dose of progesterone, it causes nausea, vomiting, diarrhea, pain, dizziness, or it might also require supplementation of analgesic. So, combined use of mifepristone, methotrexate is also used. So, one of these prostaglandin inhibitor, prostaglandins, it comes in like for example, misoprostol or gemoprost is most preferred. When you talk about misoprostol, it is stored in a room temperature, relatively inexpensive, and it can be given either orally or intravaginally. Now, there is a combination of mifepristone and misoprostol is also available, and this combination is effective till 98% in case of pregnant women. Now, what happened? Mifepristone is given orally, single doses 400 milligram to 600 milligram, in contrast to 10 milligram for emergency in contraception. Then followed 48 hours later, misoprostol 400 microgram is given, or you can also add gemiprostone 0.5 to 1 milligram vaginally, and then misoprostol is given orally and it is less effective. People complain of backache, headache, uterine cramp, which is not dose related, but there could be serious side effects that include prolonged and sometimes excessive vaginal bleeding. One has to be very careful. Another very toxic drug it is used is methotrexate. Methotrexate is used 25 to 50 milligram given orally, followed by 3 to 7 days later misoprostol 800 microgram vaginally, and it is given, and it has been reported that effectiveness is 85 to 95%, and it is only used in case of a pregnancy is less than 8 weeks of duration. So, this also can cause nausea, vomiting, stomatitis or oral ulcer, and this treatment is contraindicated if the woman is over 35 years, and those have some cardiac complication because it might precipitate heart failure. Now, you have seen that contraceptive method used in females. Now, what happened to in male contraception? Now, male contraceptive are available, we have seen the barrier method. So, the drug use and different approaches are used in male contraceptive. One of the most common is male condom or coitus interrupt, or you can use anti-androgen by direct action of the testes, or you can use estrogen and progesterone, and it causes unacceptable feminization, or we can use androgen that inhibit the gonadotropin, or there are option of use of cytotoxic drug like calcium, nitrofurans. So, there are different options are available in order to inhibit spermatogenesis. One of the drug earlier it is used is gossypol. Basically, this drug is non-steroidal compound. It is obtained from cotton seed. Now, what it does is it suppresses the spermatogenesis, and at the same time it also reduces sperm motility. So, this it is reversible, fertility is restored after several months, like once you discontinue it is reversible. But only disadvantage is there could be permanent azoospermic, and this effect is lasted for more than 6 months. Now, most commonly used practice in India is vasectomy. Less than 60 years of man, no past history of sterilization, or minimum 1 centimeter vas deferens is removed, and are ligated and folded back themselves, and person is not sterile for around 3 months, and this vasectomy is overall most cost effective and most popular in India. So, in male also we have various options. Most commonly convenient practice is barrier method, but other method is also there. You can see that vasectomy. So, contraception is required in order to control the fertility, in order to control the population. But at the same time, we have to also consider that it is also going to help us in reducing the maternal mortality or infant mortality and to have a healthy population. Thank you very much.